Bismillahirrahmanirrahim and Assalamu alaikum. My name is Dr. Shanzi and today the topic of our lecture is drug used in nervous system. So जब भी nervous system की बात होगी then do remember that neuron is a basic fundamental unit of the nervous system that involved in receiving the information and also control the coordination movements of the body. So let's start it. This is the outline of your syllabus. Then nervous system. Nervous system is comprises of CNS and PNS, central nervous system, that it consists of the brain and spinal cord, and the periphery nervous system, that may be the autonomic and somatic. Somatic means वो system जो हमारे control में हो, that is voluntary, such as our skeletal muscle, and autonomic, that is involuntary in action, not under our control, like our cardiac muscles, smooth muscles. Autonomic nervous system is divided into sympathetic and parasympathetic. Sympathetic is fight and flight and the parasympathetic is rest and digest. तो कि आपके rest mode पे activate होगा. Now there is a periphery nervous system that controls the skeletal muscle is somatic nervous system that is under our control and only having the one neuron, afferent limb. That's mean कि इसके पास सिर्फ और सिर्फ एक न्यूरॉन है जिसने पूरी कोऑर्डिनेशन को कंट्रोल करना है अपनी, जबकि ऑटोनॉमिक में दो न्यूरॉन होते हैं. फर्स्ट वाले वन को हम कहेंगे प्री गैंग्लियोनिक न्यूरॉन एंड सेकंड वन इज नोन एज अ पोस्ट गैंग्लियोनिक न्यूरॉन. बिटवीन दैट न्यूरॉन देयर इज अ स्पेस नोन एज अ सिनेप्टिक क्लेफ्ट. इस सिनेप्टिक क्लेफ्ट में हमारा न्यूरोट्रांसमीटर रिलीज होगा एंड ऑल्सो अटैच टू द नेक्स्ट वन. Now the parasympathetic nervous system, also known as a craniosacral outflow. What's that mean? Whenever there is the parasympathetic activation nervous system, जो हमारे पास nerves निकलेंगे वो the cranial and the sacral part of the spinal cord से originate होंगी, जो हमारे body को control करेगा, coordinations को control करेगा. अगर हम आइज की बात करें, जब पैरासिम्पैथेटिक नर्वस सिस्टम एक्टिवेट होता है तो हमारा पिपल कॉन्स्ट्रिक्ट होता है. इफ़ टॉक अबाउट द लैक्रिमल ग्लैंड दैट स्टिमुलेट द ट्री ड्यूरिंग पैरासिम्पैथेटिक नर्वस सिस्टम. सैलिवरी ग्लैंड थिन वाटरी सिक्रेशन, ब्लड वेसल्स डायलेट कर देता है, हार्ट डिक्रीजेस द हार्ट रेट एंड फोर्स ऑफ कंट्रैक्शन. इफ वी टॉक अबाउट द लंग्स, do remember during the parasympathetic nervous system activation our lungs is constrict. In GIT that increases the muscle motility and tones, while in the urinary system they causes the contraction of the dorsal muscles and the relaxation of the sphincter muscles causes that cause the increase in the urination. तो ये था पैरासिम्पैथेटिक नर्वस सिस्टम के बारे में, जहाँ की नर्व्स निकल रही हैं क्रेनियल एंड सैक्रल पार्ट ऑफ स्पाइनल कॉर्ड से. If we talk about the sympathetic nervous system, that is a thoracolimbar outflow. That means thoracic and lumbar nature of the spinal cord से इसकी nerves originate हो रही हैं. अब आइज पे क्या करेगा, ये pupil को dilate कर देगा. On the lacrimal gland causes the no tear. On the salivary gland causes the this secretion. On the blood vessels they contract it. Heart, during the sympathetic nervous system they increases the force of contraction as well as their heart rate. लंग्स डायलेट ड्यूरिंग द सिंपैथेटिक. पैरासिम्पैथेटिक में कंस्ट्रिक्ट होते थे एंड सिंपैथेटिक में डायलेट. जीआईटी की मसल्स मोर्टेलिटी इन टोन डिक्रीज कर देगा एंड यूरेनी में डिक्रीज इन यूरिनेशंस. नाउ द नेक्स्ट टॉपिक इज द एनसेड्स, नॉन स्टीरॉयडल एंटी इन्फ्लामेटरी ड्रग्स. सो द एनाल्जेसिक्स इज द एजेंट विच रिलीव द पेन. Antipyretic reduce the temperature and anti-inflammatory reduce the inflammation or swelling. Then classification of the analgesic, that may be the narcotic or non-narcotic in nature. If there is a narcotic opioids like a morphine, codeine, heroines, they primarily main action on the central pain mechanism and have the no necrosis as a side effects. And known narcotics, that is known opioid like our aspirin, mefenamic acid, diclofenacs, the primary action on a peripheral pain mechanism and have the no necrosis mechanism. This is the NSAID, that is known opioids and known narcotics. These include the non-steroidal anti-inflammatory drugs. They are effective for the mild to the moderate headache and the pain of the musculoskeletal origin. Also, there is a lower body temperature. Mechanism of action: they inhibit the prostaglandin formation in the inflamed tissue by the two action. Prostaglandin is a hormone in our body that causes that involve in increase in the temperature as well as the pain perception. जितनी भी आपको pain feel होती है due to the prostaglandin, whenever you get an injury, this very hormone is released out and cause you to feel the pain. Now, what the NSAID do? They inhibiting the stimulation of the pain receptors, inhibit the prostaglandin synthesis with the CNS, and stimulating the peripheral vasodilation to relieve the fever as an antipyretic action. Next, there is a drugs examples and the dosage, that aspirin with the dose, how much to taken and how to taken, that is orally and daily. Here you can see the more drugs. Now the indications and uses of NSAID, like a pain may acetaminophen, like a paracetamol, ibuprofen and naproxen, arthritis and osteoarthritis, bone diseases, in paroxysm in the fever, to treat the inflammatory conditions, prevention of the transient ischemic attacks, and MI, like a myocardial infarction. Then dysmenorrhea, that in mefenamic cases, and ibuprofen. Dysmenorrhea is a menstrual cramp during the periods. Its use can cause the early closure of the patent ductus arteriosus and delay of the labor due to the inhibition of the that very hormones. Now the contraindication, they are contraindicated in the pregnancy except the acetaminophen, like a paracetamol is the name of the acetaminophen. The contraindicating in aspirin, hypersensitivity. Aspirin is contraindicated in a bleeding disorder and GI ulcer. What's that mean? As I told you कि aspirin ने हमारे प्रोस्टाग्लैंडिन को inhibit कर देना है. यही प्रोस्टाग्लैंडिन हमारे पास साइक्लोऑक्सीजिनेज से जनरेट होता है, दैट इज़ अ एंजाइम. और जो हमारे पास एस्पिरिन है, दैट इज़ अ सेलेक्टिव इनहिबिटर ऑफ द कोक्स इनहिबिटर. सो whenever there is an inhibition of the COX enzyme, हमारी GIT की mucosal membrane भी affect होगी. That's why the aspirin is contraindicating in bleeding disorder and GI ulcer. Use with the caution in a patient with the asthma or a nasal pops. Aspirin should not given to the children unless under the supervision of the prescriber because of the increased risk of the Reye syndrome. Reye syndrome is the rapid worsening condition of the brain. Now the adverse effect, like a GI pain, upset, peptic ulcer, diarrhea, nausea, vomiting, heartburn, tinnitus, कानों में घंटियों की आवाज़ सुनना, headache, laryngeal edema. Aspirin hypersensitivity can produce such a sign and symptom as a rash, bronchospasm, rhinitis, and shock. Now, drug interaction, prolonged use of the acetaminophen with the NSAIDs increase the risk of the renal toxicity or failure. NSAID aggravates the GI adverse effect of the alcohol. Concurrent use of the NSAID with the anticoagulant may prolong the bleeding time and increase the anticoagulant effect. Simultaneous use of the aspirin with NSAIDs or the corticosteroid may aggravate the GIT adverse effect of the aspirin and may reduces the aspirin effect. As I told you, because of the aspirin is the selective inhibitor of the COX that decreases the mucosal membrane of the GI tract, increases the HI production. Nursing responsibility. Now instruct the patients to take the oral NSAIDs drugs with the food to minimize the GI irritations. Obtain the complete health history including the allergies, drug history, and the possible drug interaction. Administer the liquid aspirin immediately after mixing because it breaks down rapidly. Advise the patient not to take ibuprofen and naproxen concurrently. Instruct the client to report the bleeding, abdominal pain, anorexia, heartburn, and jaundice. Anorexia is not feeling the hungry. Monitor the sign of the GI bleeding and the hepatotoxicity. Instruct the client to immediately report the change in the urination, flank pain, and a pitting edema. Flank pain is the pain at the side of the body. It usually between the lower limbs and your pelvic. ना पिटिंग एडिमा कि जब स्वेल आपका लेग हो उसको आप टच करें, then there is a pit formation in it. Then monitor for the hypersensitivity reaction. Now the opioids narcotics जो अभी हमने पढ़ा था वो थे non opioids non narcotics analgesics. Now there is the opioids and narcotic analgesics. In the old term of the opioid narcotic analgesics, old term of the opioid analgesics. They are pharmacologically similar to the morphine that is obtained from the opium poppy plants, and they act on a opioid receptor. Opioid receptor is a mu receptor. 5 receptor होते हैं हमारी बॉडी में centrally, that is for the opioids. Mechanism of action: opioid agonist binds to the opioid receptor in the CNS to alter the perception of the emotional response to the pain. They produce the analgesia by elevating the pain perception threshold and changing the pain reaction and the production or the induction of sleep. These are the drugs of the opioids and analgesics along with their dose and dosages, how much to take in and which route, through which route it could be taken. Now, indication and use to treat the pain that is unresponsive to non-opioid analgesics. Adjuncts to anesthesia used to relieve the cough, myocardial infarction, pain in the treatment of diarrhea. Contraindication is a patient, usually a patient with the head injury, hepatic or a renal disease. Caution in a CNS depression or in a pregnant or a breastfeeding woman. Use cautiously in adultery and the deliberate patient who may need the decreased dose. Adverse effects include the sedation, constipation, hallucination, respiratory depression, dizziness, dysphonia. Now, what is meant by dysphonia is the abnormal voice. Then, orthostatic hypotension and physical dependence. Drug interaction, they simultaneously used with the alcohol, antihistamine, hypnotics or sedatives. They causes the addictive CNS depression. अब जितने भी एंटीहिस्टामिन्स, हिप्नोटिक्स और सेडेटिव्स आ रहे हैं और ये में से एंटीसाइकेट्रिक ड्रग्स हैं, इन्होंने ऑलरेडी आपके सीएनएस को डिप्रेस किया हुआ है स्लीप मोड में. अगर आप ओपियोइड एनाल्जेसिक्स इनके साथ साइमल्टेनियसली लेंगे वो आपके सीएनएस को और डिप्रेस करेगी. दैट्स मीन देयर इज अ चांसेस टू गो इन द कोमा. So concurrently with use with the non-opioid analgesics may enhances the pain relief. Nurses' responsibility: they should assess the patient BP, pulses, respiratory status before administering the drugs and periodically throughout the analgesic therapy to prevent the withdrawal symptoms. Discontinue opioid analgesics gradually after the long-term use. Instruct the patient to take the oral analgesics with the food to minimize the GI irritations. Now there is a sedative and hypnotics. What is a sedatives? A drug that reduces the excitement and calms the subject without inducing the sleep. It causes drowsiness. And hypnotics are the drug that induce or maintain the sleep, similar to the normal arousable sleep. And what is a tranquilizer? A drug that is relieve the tension, anxiety without affecting the consciousness and without producing the drowsiness or sleep. Both sedation and hypnosis may be considered at the different grade of the CNS depression. Now, sedative and hypnotics classification may be the barbiturates and non-barbiturates. Non-barbiturates include the benzodiazepine and non-benzodiazepine, while the barbiturate includes the long-acting, intermediate-acting, and a short-acting. These are the classification of the drugs of the hypnotics and sedatives. First of all is benzodiazepine, the most commonly used medication in a psychiatry. In addition to their effect as an anti-anxiety medication, they are also used as a sedatives, anticonvulsant, and having the muscle relaxant properties as well. Mechanism of action: they bind to the receptor which is located in a neuron in the brain called the GABA receptors, and the GABA is a neurotransmitter in a brain. It is actually one of the most prevalent inhibitory neurotransmitter in a brain. Pharmacological action is a sedation, hypnosis, muscle relaxation, anticonvulsant, CNS depressant, amnesia, and anesthesia. What is amnesia? Amnesia is the lack of the muscles control due to the damage of the brain part. Hazes are the drugs of the hypnotics and sedatives. Now, indication as a sedative in treatment of the status epilepticus, insomnia, muscle relaxants, general anesthesia as a hypnotics, pre-anesthetic medication, anticonvulsant, and during the alcohol withdrawal. Contraindication is the dose patient that is a hypersensitive to the benzodiazepine. Then other class of the drug can be given like a barbiturates, shock, coma, pregnancy, lactation, inguinal hernia, the hernia in abdominal cavities. Acute alcohol intoxication used causally with the elderly and deliberated patient, impaired renal and hepatic function. Now the adverse effect, that is a tolerance and the physical dependence, confusion, lethargy, like a lack of energy, headache, impaired motor coordinations, incontinence, drowsiness, amnesia, weakness, blurred vision, tachycardia, and the urinary retentions. Now the drug interaction. Antacids decreases the absorption of the benzodiazepine. Carbamazepine decreases the benzodiazepine level. Cigarette smoking decreases the effect of the benzodiazepine, and hormonal contraception, cimetidine, erythromycin, and some antidepressant may increases the plasma level of the benzodiazepine. Whenever we talk about the drug interaction, we have to look that the plasma level should not be very high and should not be very low. They should be in a therapeutic range. तो ऐसी ड्रग्स को हमने इनके साथ नहीं देना जो उसके थेरेपेटिक लेवल को या तो बढ़ा रही हैं या फिर कम कर रही हैं. Now nursing responsibility, take this drug exactly as prescribed. Do not stop taking this drug without consulting the healthcare provider. Tell about the side effect to the patient. Carefully monitor BP respiration during the IV administration. Maintain the patient IBIO chart. Receiving the parenteral benzodiazepine in a bed for the 5 hours. Do not permit the ambulatory patient to drive the vehicle during following an injection. Monitor the liver and hepatic function and CBC during the long term. Now barbiturates. These drugs are the derivative of the barbituric acids. These are the general depressant, but nowadays they are not preferred as a sedative and hypnotic due to their side effects. Now the exact mechanism is unknown how it depresses the cerebral cortical activity. अब बार्बिटरेट्स का वही मैकेनिज्म ऑफ एक्शंस फॉलो किया जाता है जो कि हमारे पास बेंजोडाइजेपिन का था. सेम दे एक्ट सेंट्रली ऑन द GABA receptors having the inhibitory effects and causes the CNS depressant. These are the drugs of the barbiturates according to their mechanism of action, duration of action, that long acting, short acting, and intermediate acting. Now the action is a powerful cerebral depressant, depresses the cardiac activity, and in a higher dose cause fall in BP. They produce the urine flow and depress the respiratory center in a brain. Indication as a sedative, anticonvulsant, anesthesia, conjecturious as increase the conjugation of the bilirubin and increase the clearance of the bilirubin. Now what is meant by it? Conjunctivitis is the rare serious complication of the untreated jaundice. Contraindication in the liver, kidneys, and the pulmonary diseases. Adverse effect is a drowsiness in the next morning, respiratory depression, physical as well as the psychological dependency. Hypersensitivity reaction may occur and drug tolerance. Now the drug interaction, they increase the metabolism and decrease the effectiveness of the many concurrently used drugs, including the hormonal contraceptives and warfarin. Warfarin is a anticoagulant drug. Now there is a nurse responsibility that administer the IV dose slowly. Monitor the pulse, BP, respiration carefully during the IV administration. Advise the patient to avoid the alcohol, sleep inducing OTC, that over the counter drugs. They could cause the dangerous effect. Advise that avoid becoming the pregnant while you are taking these drugs. Use other method of the contraception in the place of the oral contraception, which may lose their effect with these drugs. Take this drug longer than 2 weeks for insomnia. Now the histamine or antihistamine. Actually, the histamine is responsible for the symptoms of allergies and the anaphylactic shock. In some following conditions, histamine is released, causes the tissue damage, cause and chemical injury, allergy condition like antigen reaction जो कि आप immunity में पढ़ते हैं. Now there is a three types of the histaminic receptors H1, 2 and 3. H1, by stimulating the H1 receptor, it causes the histamine dilate the small blood vessel. It increases the bronchial secretion with the contraction of the bronchial smooth muscles. They stimulate the peripheral sensory nerves. By stimulating the H2 receptor, they cause increase in the secretion of the acid and the pepsin from the stomach. Secretion of all exocrine gland, pancreatic, bronchial, salivary, and the lacrimal gland are increased. Now the antihistamines are the drug that used in a treatment of the allergic disorder and some other conditions. These drugs block the effect of the histamines and receptors. So these are the types, three types of histamine. Now their blocking agent also the three types. The mechanism of in action involved that block the effect of the histamine and the receptors. And these are the types of the drugs according to their onset of action. Now indication is no therapeutic use, only the experimental use. Antihistamines drug used in a treatment of the allergy disorder and some other condition and block the effect of the histamine and their receptors. These are the drugs. Same. Now the indication is the allergic reactions like a high fever, vasomotor, rhinitis, urticaria, asthma and the anaphylaxis. Because of their anticholinergic action, they are used as the antiemetic and the useful in a motion sickness. Whenever we talk about the anticholinergic antihistamine, do remember they causes the sedation. So never ever take these with the antidepressant. As hypnotic, mild sedative and anxiolytic. Parkinsonism, insect bites and stings, emergency condition for the anaphylaxis. Adverse effect is a drowsiness and common dryness of mouth, blurred vision, urinary retention, constipation, delirium, convulsions, and the severe toxically may causes the death due to the cardiac and respiratory failure. As I told you, they are having some CNS depressant activity as well. Now contraindication is in hypersensitivity, neonate lactation, special precaution in acute asthma and the pregnancy, adultery and epilepsy, coma and hypokalemia. Now the nurse responsibility. Antihistamine at the given in the evening since all antihistamine cause the drowsiness. Advice to the patient not to drive the vehicle or do not operate the machineries. Advice to patient to avoid the sedatives such as alcohol or a sedative hypnotics. नाउ द CNS स्टिमुलेंट. अभी तक जो हमने पढ़ा था वो थे डिप्रेस करते थे CNS को, जो हमारी स्लीप को अवेक करते थे. नाउ अब हमारे पास है CNS स्टिमुलेंट. दीज ड्रग इंक्रीज द एक्साइटेबिलिटी ऑफ द नर्वस टिश्यू. दिस ग्रुप इंक्लूड द एम्फेटामाइन, कैफीन, एनालेप्टिक्स, monoamine oxidase inhibitor and cyclic antidepressant. Mechanism of action: they increases the neurotransmitter levels in the CNS, either by the increasing the neuronal discharge or by blocking in an inhibitory neurotransmitter. These are the drug of the CNS stimulant. Now indication to treat the hyperactivity, to increase the mental alertness and the respiratory rate. Dozapram is used to treat the respiratory failure, sedatives and the hypnotic poisoning, mental retardation and the attention defense disorder in a child. Senile dementia. Dementia is a memory loss, memory disturbance. Now they also use in a peripheral vascular diseases. Contraindications: severe CVS disease, glaucoma, used with the caution in a patient with the psychosis or in a pregnant and the breastfeeding वुमेन में कंट्राइंडिकेशन है। Now, adverse effect is the restlessness, irritability, hypertension, CV collapse, like cardiovascular collapse, fatigue, growth suppression in a child, tremors, insomnia, angina, weight loss, and irritability. Now, the nurse responsibility assess the patient behavior to determine the drug effectiveness, monitor the growth in such a children who is receiving the long-term therapy. During the disease program administration, assess the patient respiratory status like a lung sound rate and the depth of respiration. Instruct the patient to take last daily dose 6 hours before the bedtime to present the insomnia. Now the skeletal muscle relaxant. Muscle relaxants are drugs which affect the skeletal muscle functions and decreases the muscle tone. They may be used to alleviate the symptoms such as a muscle spasm, hyperreflexia, and pain. Mechanism of action: they work directly by acting on a neuromuscular function or indirectly by acting on a CNS and interfere with the calcium release in a muscle fiber and interfering with the muscle contraction at a neuromuscular functions. So these are the drugs of the muscle relaxant. Indication usually in a painful spasticity associated with the cord disease like a spinal cord disease, in acute and a painful musculoskeletal conditions and in a muscle spasm. Indications is a dry mouth, constipation, lightheadedness, drowsiness, fatigue, blurred vision, dizziness, and ataxia. Contraindication in a patient who have the hypersensitivity to these drugs, and a contraindication in arrhythmia, heart block, heart failure. Used with the question of patient with breastfeeding mother who has the hepatic disorders. Now the drug interaction simultaneous with the other CNS depressant alcohol causes the additive CNS depression. Simultaneous use baclofen with the antidepressants, that is the MAO monoamine oxidase inhibitor, may cause the hypersensitive crisis, seizure, and death. Now the muscle responsibility. The nurse should advise the patient to take the muscle relaxant with the meal or a milk to prevent the GI upset. Assess affected joints for the pain and immobility. Nurse should teach the patient to avoid the alcohol and CNS depressant. Keep emergency equipment nearby to treat the respiratory infection. Now, the next topic is antidepressant. This is a type of medication used to treat and prevent the depression. Tricyclic antidepressant increases the amount of the serotonin, norepinephrine, through the reuptake inhibition. बंदे को डिप्रेशन तब होता है जब सेरोटोनिन और नॉन एपिनेफ्रिन का लेवल बॉडी में ड्रॉप कर जाए. दीज आर द हार्मोन, रेगुलेटरी हार्मोन इन आवर बॉडी. सो ट्राइग्लाइसिक एंटीडिप्रेसेंट क्या करेगा? दे इनहिबिट द रीअपटेक ऑफ दीज हार्मोन्स, increases their plasma level and causes having the antidepressant action, thus normalizing the hyposensitive receptor site associated with the depression. Selective serotonin reuptake inhibitors, they block the reuptake of only the serotonin in a presynaptic cell, thereby increasing the serotonin level of the synapse. Biogenic amines such as the 5-hydroxytryptamine, noradrenaline, dopamine are inactivated by the enzyme like a monoamine oxidase. So हम यूज़ करेंगे monoamine oxidase inhibitor that lead to the accumulation of these amine in a brain, thus produces a antidepressing effect. अब मोनोअमीन ऑक्सीडेज इनहिबिटर का हमारे स्टैटिन्स, एंटी हाइपरलिपिडेमिक्स ड्रग्स के साथ इंट्रैक्शन बहुत होता है. दैट्स व्हाई देयर इज that's why they can't be given with it. These are the drugs of antidepressant along with the dose and dosage. Indication: use in a endogenous depression, depression associated with the other disease, use in a phobic anxiety like a school phobia, compulsive phobic state, anorexia like the bed wettings, obsessive compulsive disorder like OCDs, bulimia nervosa. Bulimia nervosa is a condition of the self-induced vomiting. It is a eating condition. Smoking cessation and premenstrual dysphoric disorders. Contraindication: concurrent use of the fluoxetine and the monoamine oxidase inhibitor is contraindicated. They also contraindicated in the active liver diseases. This is acute liver diseases. Precautionary use in elderly patients and in hepatic and renal patients. Adverse effects: the tricyclic antidepressant may cause the orthostatic hypertension, tachycardia, blurred vision, constipation, seizure, and dry mouth. It may exaggerate the heart failures, may causes the testicular swellings or a gynecomastia in male, insomnia, nausea, and anticholinergic effect. Overdose can cause the CNS stimulation, even the hallucination and convulsions. Drug interaction: they alter the action produced by the drug acting on a sympathetic nervous system. When administered simultaneously, it may reduce the effectiveness of antihypertensives. Simultaneously used with the alcohol, antihistamine, and other CNS depressants cause the additive CNS depression. Antidepressant with the monoamine oxidase inhibitor may causes the hypertensive crisis and seizures. Now there is a nursing responsibility. They should know that these drugs should be discontinued gradually. They should instruct the patient about the importance of the compiling with the therapies. These drugs may take the several weeks to produce the desired effect. They should warn the patient to avoid the alcohol and other non-prescribed drugs to prevent the ARDS. Nurse should know the persistent headache is often the warning of the rising BP in a patient on monoamine oxidase inhibitor. They should tell the patient not to control the release tablet. Now, anti-manic. Mania is a condition which could characterized with the elevated mood with increased emotional liability, excessive talking, increased psychomotor activity with the marked euphoria. When mania occur with depression, this condition is known as the manic depressive psychosis. Now, mania is a condition कभी खुशी कभी गम वाली कि एक टाइम पे बंदा खुश है, at the same moment they begin to cry and they don't have any idea because this is a CNS disorder. So lithium is only the drug that is used in the treatment of mania. Now, mechanism of action: the effect may result from increase in the norepinephrine reuptake and serotonin sensitivity. Lithium probably interact with the calcium, sodium, magnesium ion in the body. Now, these are the drugs to treat the mania. Indication is the mania bipolar affective disorder and manic depressive psychosis. Now, contraindications, precautions: in a severe renal and a severe disorder during the pregnancy, breastfeeding, and the severe dehydration. Use cautiously with the elderly patient as well. Adverse effect at the therapeutic level: nausea, vomiting, fatigue, and a muscular weakness and polyuria. Above the therapeutic level, they causes a severe nausea, vomiting, convulsions, coma, and the circulatory failure. Most common area are the hand tremors, transient muscles weakness, hypertonia, bloating, diarrhea, anorexia, abdominal pain, and anorexia as well. Antimanic causes the hypothyroidism. They causes a decrease in a thyroid hormone secretion. Now, drug interaction. Sorry. Diuretics, tetracycline, that is the antibiotics, and indomethacin, that is the NSAID with the lithium, may increase the plasma level of the lithium and increase the risk of toxicity. Lithium interfere with the effect of the haloperidol and succinylcholine, non-adrenaline. Acetazolamides, aminophylline, sodium bicarbonate, and an increased sodium intake may cause the renal excretion of the lithium and decreases its effectiveness. Here is the nursing responsibility. They assess the therapeutic blood level during the course of therapy, should teach the patient and the family to observe for the sign of the lithium toxicities like diarrhea, vomiting, drowsiness, ataxia, convulsions, and confusions. They should assess for the suicidal tendencies and institute the suicide precaution as necessary. They administer the drug with food to minimize the GI irritation. They should instruct the patient to consult the physician or the pharmacist before taking non-prescribed drug to prevent the ARDS. The nurse should teach the patient to drink 2 to 3 liters of the fluid daily, maintain the adequate salt intake, avoid the excessive amount of the coffee, teas, colas, and the activities that can affect the sodium load. Avoid the driving and other hazardous activities. Now the antipsychotic. Our topic is antipsychotics. The drug that is mainly used for the treatment of the major psychosis like schizophrenia and mania caused by the bipolar disorder. They are also called as a major tranquilizers. Antipsychotics is known as a tranquilizers. And schizophrenia is the false hallucinations, delusions जितनी भी आपको होती हैं. That is a schizophrenia like a fake perceptions. कि एक चीज़ नहीं है लेकिन बंदे को लग रहा है कि वो हमारे सामने ही है. और this is the only condition that is untreatable. There are two main types of the antipsychotics, atypical antipsychotics and the older antipsychotics. Now there is a word typical and atypical antipsychosis. Atypical causes are more common because the typical one causes an extrapyramidal effect, that is a movement disorder, extrapyramidal syndrome. Mechanism of action: they block the neurotransmitter dopamine in the limbic system, inhibiting the transmission of the neuronal impulses. Now these are the examples of the antipsychotic drugs along with the dose and dosage. Indication is the psychosis, schizophrenia, depression with the psychotic feature, psychotic symptoms associated with the organic brain syndromes. Butyrophenones are used to treat the nausea, vomiting during the surgery and a diagnostics procedure. Haloperidol as the adjunct to the anesthesia. They also used to treat the psychosis behavior problem in children with the explosives, hyperexcitability, hyperactivity in hyperactive children. Atypical antipsychotics are used to treat the obsessive compulsive disorder, OCD. Now contraindicated in the CNA depression, risk of suicide, pregnancy, first trimester like a first 3 months. Angle closure glaucoma commonly used in an elder patient and those in an acute myocardial infarction, heart disease and respiratory distress. Drug interaction. Antacids decreases the absorption of the antipsychotic. These drugs potentiate the alcohol and CNS depressant. Concurrent use of the antipsychotics with the anticholinergic increasing the antihistamine and antiparkinsonism, and antidepressants may increase the anticholinergic side effect. Now the nursing responsibility: they should tell the patient to avoid the driving and other hazardous activities until the CNS effect of the drugs are known. Advise the patient to avoid the alcohol and CNS depressant during therapy. Should tell the patient that the phenothiazine may discolor the urine pink or a red brown. This is a side effect of this drug that causes the urination to turn into the pink or red brown. Should monitor for the extrapyramidal symptoms and the other adverse reactions. Extrapyramidal symptoms is the movement disorders. They may include the dystonia, akathisia. Dystonia is a repetitive movement of the muscles, and akathisia is inability to remain still. This is a movement disorder. Nurses should know that the patient taking the long-term antipsychotic treatment, which should undergo the regular elevation of the red and white blood cell count. Do not give the antacids within 1 hour of the giving this drug to avoid the drug interaction. Should assess the patient mental state. If given the parenteral dose, monitor the patient for the orthostatic hypertension. Orthostatic hypertension is whenever we sit and suddenly wake up, we face the drowsiness. This is the orthostatic hypertension. Nurse should advise the patient to use the sunscreen and use the protective clothing to prevent the photosensitivity reactions. Now anticonvulsants that prevent and reduces the severity and the frequency of the seizures in a various type of epilepsy. Mechanism of in action: they involve the enhancement of the GABA actions and inhibition of the sodium channel activity. Thus, it decreases the spread of the abnormal electrical discharge. These are the drugs of the anticonvulsants, or you may say the drug used in epilepsy. Indication: phenytoin can be used in all epilepsies except the petit mal epilepsy. And what is meant by the petit mal epilepsy? This is the absence epilepsy, the most common in child. They include the grand mal epilepsy, psychomotor epilepsy, focal seizure, and the status epilepticus. Phenobarbital can be used to control the tonic-clonic epilepsies, simple partial febrile convulsions, and the drug withdrawal seizures. Benzodiazepines like this are used in a status epilepticus because of their mechanism of action is they are the GABA inhibitor. Valproic acid is specifically used in the absence, that is a petit mal, common in child, and akinetic seizures. Carbamazepine is useful to control the psychomotor epilepsy, grand mal epilepsy, and mixed seizures. It is also used in a trigeminal and the glossopharyngeal neuralgias. Acetazolamide used in a combination with the other anticonvulsant drugs in a petit mal seizures and the focal seizures. Contraindication in the patient who have the sensitivity to the drug. Phenytoin is contraindicated in the patient with the sinus bradycardia, second and a third degree heart block. Barbiturate like a phenobarbital contraindicated in the patient who are sensitive to the barbiturates and in the pregnant and the breastfeeding mothers. These are also contraindicated in the patient with a hepatic impairment and the severe respiratory disease. Contraindicated in the patient with the bone marrow suppression and within 14 days of the monoamine oxidase inhibitor therapies. Adverse effects include the sedation, drowsiness, drug dependence, dizziness, slur speech, both those speech that is difficult to understand, nausea, vomiting. Carbamazepine prolonged use causes the bone marrow suppressions, photophobia, ataxia, respiratory and severe depression, blood dyskinesis are like blood disorders, gum hypertrophy. Drug interaction include the alcohol dioxide, influenza vaccine, rifampicin, folic acid but decreases the phenytoin activity and decreases the drug effectiveness. Amiodarone, an antihistamine, chloramphenicol, cimetidine, diazepam, disulfiram, oral anticoagulant, salicylate, valproate may increases the phenytoin activity, may lead to the increase the phenytoin toxicity. Alcohol may cause the additive CNS effect and death. Benzodiazepine may increase the digoxin level and digoxin toxicity if it is given together. Hormonal contraceptive decreases the metabolism of the benzodiazepine. Now the nurse responsibilities. They should monitor for the sign and symptoms of the toxicity. Sign of the anticonvulsant toxicity: one is a ataxia, nystagmus, dysarthria, hypertension, and coma. Ataxia, as I told you, that is a lack of the muscle movement due to the damage of the brain part. Nystagmus is a involuntary eye movement. Dysarthria is the slurred speech that is difficult to understand. Okay. Now teach the patient about the importance of the good oral hygiene and regular dental examination to prevent the gingival hyperplasia. This is the ADR of the hypertension. This is the ADR of the phenytoin. Due to the hypertensivity concomitant disease. Nurse should teach the patient to avoid the alcohol and self-medication with OTC's drug. Also teach about the compliance with the therapy, avoidance of the abrupt decondition and the consistent use of the same drugs preparation because changing the drug brand may differ the bioavailability among the brands. Assess the respiratory status before and during the therapy and should also monitor the patient for the withdrawal symptoms. Do not mix the IV diazepam with the other drug in the same syringe. Give the diazepam by the direct IV push only. Do not give as an infusion. Now the psychological dependence may develop with the use of the clonazepam and the diazepam. Anti-anxiety drugs, that is a minor tranquilizers. It is a group of the mild CNS depressant which are used to control the symptoms of anxiety. They produce the calming effect in an anxiety state. Mechanism of action: they cause the generalized CNS depression, mimicking an enhancing the effect of the GABA by antagonizing the protein that inhibit the GABA binding to its receptors. These are the drugs of the benzodiazepines. They are commonly used anti-anxiety drug. They have the anxiolytic, hypnotic, muscle relaxant and anticonvulsant action as well, and used to treat the anxiety. Diazepines used to produce the skeletal muscle relaxation, treat the insomnia, and induce the sedation and amnesia as well. Contraindication in the pregnancy, pre-existing CNS depression, and causally in the elderly patients who may require the decreased dose, and in the patient with the renal and hepatic impairment. Adverse effect is the drowsiness, ataxia, temporary memory impairment, excitement, respiratory. Drug interaction, the NSAIDs may decreases the absorption of the benzodiazepine. Erythromycin, cimetidine, antidepressant may increases the plasma level of the benzodiazepine. Cigarette smoking decreases the effectiveness of the benzodiazepine. How cigarette smoking affect the effectiveness of the benzodiazepine? Like, benzodiazepine is a CNS depressant, and the cigarette smoking having the nicotine in it is itself is a CNS stimulant. So whenever these taken, एक CNS को डिप्रेस कर रहा है, दूसरा अवेक कर रहा है, ऑब्वियसली बात है कि सिगरेट स्मोकिंग का ज़्यादा इफेक्ट आएगा. दैट्स वाई दे डिक्रीज द इफेक्टिवनेस ऑफ द बेंजोडाइजिपीन. Now, nurse responsibility, they should administer the IV dose slowly. Should advise the patient not to increase the dosage unless instructed by the physician. Instruct the patient to avoid the hazardous activity like a driving and the swimming, etc. Now, anesthesia. Anesthetic drugs or an agent that produce a complete or a partial loss of the feeling. There are three types: general, regional and localized. सबसे पहले जनरल एनेस्थीसिया यूज टू प्रोड्यूस द लॉस ऑफ कॉन्शियसनेस बिफोर एंड ड्यूरिंग द surgery. General anesthesia are usually given by the inhalation or by injecting into the vein. They stabilize the neuronal membrane to produce a progressive and reversible CNS depression. These are the drug of the general anesthesia that is given by the IV or a inhalation route. Indication to induce the anesthesia: prolong the anesthesia when used with the anesthetic as a muscle relaxant to produce a loss of consciousness. Contraindicated in the patient with the severe respiratory instability and the occasionally in the elderly and the deliberated patient because they are predisposed to exaggerate the response to the drug. Adverse effect is a respiratory depression, muscle twitching, apnea, tachycardia, memory loss, depression, hypertension, confusion, arrhythmia, and nausea, vomiting. Contraindication: concurrent with another CNS depressant, increase the CNS and the respiratory depressions and hypertension as well, increasing the hypotensive effect if it is given with the labetalol, that is a beta blocker. Nurse responsibilities: should assess if the patient have the allergy before the surgery. They should assess the severe respiratory, renal condition and a level of the consciousness before or after the surgery. They should always give the atropine available to reverse the bradycardia. I should advise the patient not to take it or drink anything for at least 8 hours before the surgery to prevent the aspiration and the gastric content into the respiratory passage during the anesthesia. Nurse should know the shivering is normal during the recovery. If the shivering occurs, keep the patient warm with the extra blanket or heat and maintain the side-lying position to prevent the aspiration after any procedure in a general anesthesia, and also the oral intake until the ability to swallow. Now, the localized anesthesia that affect are restricted to a specific area of the body. Mechanism: they block the conduction of the nerve impulses, thus provide the analgesic relief. These are the drugs of the local anesthesia. Indication to relieve the pain from the surgery, disease or injury. To use on a skin or a muscle membrane to provide the anesthesia for itching, burning and short procedure for the severe pain unrelieved by the topical anesthesia and analgesics. Contraindicated patient with the drug hypersensitivity, impaired cardiac condition, cognitive with the patients with the hepatic disorder, heart block, hypertension and other endocrine disorder. Then the myasthenia gravis, that is a muscles disorder. Adverse effects are restlessness, hypertension, meiosis, hypersensitivity reaction, anxiety, bradycardia and tinnitus as well. Drug interaction, they may increase the CNS depression when it's used with the CNS depressant. They prolong the anesthetic effect if used with the epinephrines. Nurse responsibility, they should ensure the gag reflex or gag reflex, our pharyngeal reflex that restrict the entry of any foreign particles. Have they returned before feeding the patients whose throat has been anesthetized during the post-operative phase? Nurse should assess for the return of the motor function and sensations. Topical anesthetics. पहले हमने पढ़ा generalized, then localized. Now there is a topical anesthetics. Is a local anesthetic which is used to numb the surface of the body part. Mechanism of action. They work by blocking the nerve impulse transmissions. They accumulated in the nerve cells membranes and cause it to expand and lose its ability to depolarize. These are the drugs of the topical anesthetics. Indication use of the topical anesthetic, they typically either they relieve existing pain from the body surface or prevent the pain during the medical examination or procedure. To anesthetize an area before an injection is given to numb the mucosal surface before a tube or a catheter is inserted. Contraindicated in patient with the drug hypersensitivity, lidocaine should be given. Occasionally in a elderly patients and a patient with the large area of the broken skin or a mucous membrane. Adverse effect is a hypersensitivity reaction including the rash, pruritus and the dyspnea. Drug interaction is a lidocaine may increase the risk of the lidocaine toxicity. So should not be used with the blockers or a cimetidine like a histamine blockers. Nurse responsibility should assess the site where the topical anesthesia applied before, during and after the drug administration. Discontinue the drug if the rash develop, or you may say if the hypersensitivity reaction occur. Adrenergic blockers. Now mechanism of the adrenergic blockers. They causes the vasoconstriction in our blood vessels. Thus, these drugs prevent the stimulation of the adrenergic receptor of the sympathetic nervous system, thereby decreasing the cardiac output. तो थोड़ा पीछे लेक्चर की तरफ जाएं तो I told you about the nervous system that may be the sympathetic or a parasympathetic. Whenever we talk about the sympathetic nervous system, this is known as the adrenergic system. To agonize or antagonize them, some drugs are given. If there is a sympathomimetic drug, they agonize the symptom. And if there is a sympatholytic drug, they antagonize the system. Okay, so adrenergic blocker is a sympatholytic drugs that antagonize the sympathetic nervous system. These are the drug of the adrenergic, that is the beta blockers, atenolol, timolols. Indication to treat the mild hypertension and angina pectoris, that is the chest pain. Contraindication in a patient with the asthma, sinus bradycardia, cardiogenic shock, second and the third degree heart block. Use these drugs only in the pregnant and the breastfeeding women and in those with the impaired hepatic functions. Adverse effect: orthostatic hypertension, fatigue, bradycardia, nausea and vomiting. Drug interaction: these drugs cause the additive action on the hypertension when used concurrently with the alcohol and a hypersensitive or a calcium channel blockers. Nurse responsibility: do not discontinue the drug abruptly as they cause some withdrawal effects. Administer the propranolol consistently with food. Food may increases the absorption. Anticholinergics. Adrenergic blocker is for the that reverse the sympathetic nervous system. Now anticholinergic that reverse the parasympathetic nervous system. They cause the bronchodilation by blocking the action of the acetylcholine. Acetylcholine causes the bronchoconstriction. Mechanism of action: these agents inhibit the action of the acetylcholine neurotransmitter or block the neurotransmitter acetylcholine in the central and the peripheral nervous system. They stop the transmission of the parasympathetic nerve impulses, therefore, they lessen the spasm of the smooth muscles such as the GI, respiratory tract, and bladder. These are the drugs of the anticholinergic that reverse the parasympathetic nervous system. Indication: to reduce the salivations, gastric secretions, to induce the mydriasis, to treat a Parkinson's disease, motion sickness, GI spasm, bradycardia arrhythmias, extrapyramidal reactions like a dyskinesias. Dyskinesia is repetitive movement, that is a movement disorder, to decrease the saliva and the bronchial secretion before. Contraindication: in a urinary and a GI tract obstruction, hypersensitivity, severe ulcerative colitis, angle glaucoma, and the acute or severe hemorrhage. Adverse effect is the blurred vision, dryness of mouth, urinary retention, conjunctivitis, and the constipation. Drug interactions: a tricyclic antidepressant increases the drug adverse effect. Nurse responsibility: should monitor adverse reaction, should instruct the patient to administer the 30 minutes before the meal at the bedtime when used to reduce the GI motility. Teach the patient to reduce the dry mouth by using the ice chips, hard candies, and gums, and to reduce the constipation by exercising or increasing the fiber and fluid intake. Should monitor the intake and output and watch for the result. These are the references from. Thank you.